Hello, I'm Dr. Joel Hoffman with North Atlanta ENT and Allergy, and today I'd like to talk to you about balloon sinuplasty. Patients who present to our office with recurrent sinusitis, typically 4 to 6 episodes a year, multiple antibiotics, when symptoms keep recurring after stopping their antibiotics, are ideal patients. We often evaluate the patients with a CAT scan of the sinuses after medical therapy, and we're looking for the sinus drainage area. If it's narrowed, the balloon sinuplasty can dilate that area to help prevent infections in the future. The balloon sinuplasty can be done either in the office under local anesthesia with oral sedation, or often in the operating room under general anesthesia in conjunction with traditional sinus surgery. The sinuses we work on the most would be the frontal sinus, which is up here, or the maxillary sinus, and then the deep sinus, which is the sphenoid sinus, which is 7 centimeters behind the nose. The guide wire gets passed into the sinus. We can get light confirmation to make sure we're in the correct place. Then the balloon gets advanced into the drainage port, and it microfractures the bone, which will keep it in the open position. The anesthetic part of the procedure, numbing up the nose, takes longer than the balloon sinuplasty itself. We really take our time to make our patients very, very comfortable. Once the anesthesia is complete, the procedure itself often takes me 15 to 30 minutes depending on what sinuses we're doing. The most common sinus that we work on is the maxillary sinus, which is under the eye, and we open up in this area here. And if we're just doing that sinus, it might be a 10-minute procedure once the anesthesia, which often takes me 30 minutes, is completed. The next sinus we commonly do is the frontal sinus, which is the forehead, and we advance the guide wire up in that area. And then the sphenoid sinus is deep in the head, and those are the ones we often do. Now, sometimes we'll do all 3 sinuses, sometimes we'll do 1 or 2. Whatever it is, the surgery itself, once we're working, will take between 20 and 30 minutes. Afterwards, we watch the patients for 10 to 15 minutes, and then they go home, and literally the recovery is very quick. Often patients resume their normal activity and can go back to work the next day. If you would like more information about balloon sinuplasty, please call our office today.